I'm Ann Krisnick. I'm the Executive Director of the Joint Religious Legislative Coalition. Welcome to our second in a series of 5 webinars around housing issues. We had some homework for those of you who attended last month, and that was to look in your community. If you were an unskilled worker looking for a low wage job, you're only able maybe to get a low wage job, what might that look like if you're able to get 40 hours a week, to get some sense of that. And also to use a tool that we have that allows you to see what places to live are available in your area. You can really see what kind of affordable housing is available within a few miles, within quite a number of miles, within a distance from your home. It allows you to put in filters such as, are you using a housing voucher? Do you have a pet? Do you have accessibility issues? So if anybody did that and would like to share their concerns in the chat, I would love to see them. And then I'd really like, after we'll see if anything comes in, we're going to do a quick poll to get some understanding of where people are on some of the issues we're going to talk about tonight. So I'm not seeing anybody popping up in the chat, so I'm going to move right to the poll. And then after that, we will begin with prayer. So this is untitled poll. I suppose I could have titled the poll. I want to point out on your screen, do you see the poll on your screen or no?
No.
Okay, so I think I may need to share my screen in order for that to happen. So let's see. Share screen. I'll go back to the webinar. I don't think I can share it when it's up. Nope, I have to unshare. Okay, we'll try this again. Okay, so we are going to do the poll. Is the poll showing up? Can I see here a yes or no or a nod?
Yes.
Okay, so there are 4 questions. So you'll need to scroll through to answer all of the questions. And so if people would start, I'm going to launch the poll right now. Okay, this tells me people are viewing the questions. I can't tell if anyone's answered the questions. So if someone's answered, could you indicate yes?
Yes.
Okay, I'm going to end the poll.
Yes.
Okay, this is an abysmal failure. We're going to relaunch the poll. For some reason that didn't show up. We'll try it one more time. And okay, are people able to vote? Can someone indicate if it just shows to me that you're viewing questions and I can't tell people are voting. I'm so sorry.
I've made,
Should we
entries
answer again?
the entries.
The poll disappeared.
I did the whole poll and submitted the final the final answers. It showed me that I'd submitted them.
Yes,
Right.
and I relaunched it because nothing recorded. All that like mine shows, and we may have to not do the poll. So I can talk through the answers and you can kind of see what they say. So I'm not really sure what the problem. This says attendees are viewing the questions, but 0 have voted. So I'm just going to walk through them. We're going to talk through them. Children and youth 24 and under make up what percentage of Minnesota's experiencing homelessness? We'll see some data later tonight, which is really, to me, was shocking and incredibly sad. That's 47% of Minnesotans experiencing homelessness. So incredibly high numbers of really young people that are experiencing that. 5% of Minnesotans are Black. What percentage of those experiencing homelessness are Black? The actual number is 37%.
Yeah.
So we had 30 and 40 in there, but the actual answer is 37%. I don't know why they slowed up. Overwhelmingly, Minnesotans in the homeless population have experienced adverse childhood experiences, and we'll hear a little bit more about this tonight, but you'll see kind of the extent to which things that happen in a person's life impact them. And any of the answers on this one are correct. All of these are adverse childhood experiences. We see really high percentages in the homeless population compared to others. And then finally, which percentage or what percentage of Minnesotans experiencing homelessness have a serious mental illness? And I wanted to specifically include that definition that anxiety and panic disorders are excluded from that percentage. And even with that exclusion, the percentage of Minnesotans, this is true both for those, when we think of as youth, as well as older Minnesotans, 60%. So this isn't a problem that's easily going to be solved simply by saying if we give someone a place to live, it's going to be all right, because a lot of these folks have other issues we really need to deal with. And so we talk about not only basic housing and shelter, but supportive housing. So I'm going to do a quick review. Pastor Sue, if you are there, could you speak up? You're not showing up that you're here. So when you have someone who is in charge of a shelter for people experiencing homelessness, or in her case, actually 3, sometimes things don't always work as well as you plan. So we may have our prayer a little bit later instead of at the opening.
I'm here, and I'm sorry, I had it in my calendar at 7 and not at 6:30.
Okay, no, it's all right. So
I'm glad I hopped on early.
I'm going to stop sharing here and people will be able to hear from you. Pastor Kesterman is in charge of Churches United, Executive Director of Churches United. They run several shelters in the Moorhead area. They run a food shelf. So I asked her to just talk briefly about her work for some ideas about what congregations working together can accomplish. And then she's doing our opening prayer as well. And she is an ELCA pastor. So welcome, Pastor Sue.
Thank you so much. And my apologies for scooting in right under the wire. I really did have this in my calendar at 7. So my name is Pastor Sue Kesterman, and I serve as Chief Executive Officer at Churches United for the Homeless in Moorhead. We are 37 years old. We were founded by 11 local faith communities across the Fargo-Moorhead area. Both ecumenical and interfaith from its earliest days. As I said, we are now, I think, 37 years old, and we now enjoy the support of 253 congregations and faith communities from the region. We currently operate 3 shelters. Micah's Mission, which is emergency shelter for men, women, and families in Moorhead, Minnesota. Safe Haven, which is emergency shelter for women who are not accompanied by children in Moorhead, and the Dorothy Day House in Moorhead, which is a men's shelter. We also operate 2 food pantries, the Dorothy Day Food Pantry in Moorhead and the Dorothy Day Food Pantry West in West Fargo, just across the border in North Dakota. In 2018, we opened the Bright Sky Apartments, which are 43 units of permanent supportive housing. And we are planning to construct within the next year, the Silver Linings Apartments, which will be 36 units of permanent supportive housing for seniors 55 and older. And so I'm really excited to be with you today. We are an expression of what I believe to be the goodness of our Creator at work in the world, in the midst of everything that we do. And so, I was raised by a bird lover. My mother has been gone a couple of years now, but she loved birds, and she taught us all to love birds and to watch them and listen to their calls. But when I was just starting to learn to watch birds, I would say to my mom, "Tell me what that bird is. Tell me what that bird is." And a lot of the time she would say, oh, that's just a sparrow. And I always thought, but I love sparrows. They're everywhere, right? And so I think about the people that we serve in my work as the people in our communities who are unseen and undervalued and often unheard, kind of like sparrows. And so that put me in mind of a passage from Luke, the 12th chapter, the 6th verse. Are not 5 sparrows sold for 2 pennies, and yet not one of them is forgotten in God's sight? So will you all pray with me? Good and gracious God, we give you thanks and praise that all are seen and valued and marked in your sight. Teach us to see and hear and value one another, and especially our neighbors in our communities who are often unseen and unheard. For we know that you mark each and every one of your creations. All of this we ask in your holy name. Amen.
Thank you so much, Pastor Sue. As we talk about homelessness, one thing that it's really important that we include are the voices of people with lived experience. And we are working on a bill, you'll hear about it maybe if we have time tonight, but certainly in our solutions segment, to allow faith communities to have communities on their property to help people who've been chronically homeless. And one of the things that I learned in working on that bill was we wanted someone who would be housed there to testify at a hearing. And so we arranged for someone to be there, and she testified. It was very effective. It was sad. She testified from her vehicle, which is the place where she was living. But I recognized and kind of found out more after the fact about how incredibly stressful that had been for her. And so I've learned that if I can have someone tape a statement, it's much easier for them. They aren't as nervous. They aren't appearing in front of all of these people. So I'm going to ask Joan to put up a statement. This is from Samuel, who's actually in Moorhead and has been in the shelters and is now in supportive housing that you heard Pastor Sue talk about. And so here you can hear from Samuel. This will also be in our resource list. So if your connection isn't perfect, you can listen to it later.
Hello, my name is Samuel. My homeless, felt in the homeless for doing drugs, making stupid decisions, doing drugs, and I fell into homelessness. Some of my challenges I faced by being a minority and homeless and have a place to stay, jumping from house to house, couches, shelters, everything else. Then have my hygienes, running up to the park to get a job, want to settle, moving every 5 minutes or every 10 minutes. Challenge I faced of trying to get back into the community was struggling to find a job, to keep a job, to have a job. Just going in and out of shelters, rehabs, doing all the things, sleeping in doorways, begging for money and all that stuff. All that comes with me, and homelessness is very hard. Most of my best experience of shelters, I've been in shelters all over America, from California to New York. Church United was one of the most supported shelters that I ever been. They seemed to me, they have the solution. It was a warm-filled place. Pastor Sue, I just seen Christ in her. She just made me feel, wanted to just try to do better. Supporting housing and everything else, Moorhead, Church United seemed to have the solution to me. They have steps. You go to shelter, then you go into an apartment and learn to interact into the community and be part of the community. You have support, a lot of support. Church United team is my family now. I believe in what they're doing is a solution to solving homelessness. Looking for housing. One Church United is not easy. They have staff that help you navigate you through the homelessness, through the things in life. They're supportive of everything you do. They're so warm. I never felt, originally from Chicago, never felt a place that I belong. I feel much belong in the community. I love this community. I love being in No Head. I love what Church United's cores are doing. It's just a blessing to be here. I thank God with all my heart that I had opportunity to come here. I just can't say enough for them. It's a warm family, and I'm planted here. This is my home. This is my family, and I believe in it. And I believe in it with all my heart that you could change your life here at Church United. You can really dig in and become. I'm 58 years old, and I'm just finally getting a chance to plant myself and to realize my life and want to do better.
So that's Samuel. You'll be hearing from Doug Pyle, who was a resident at the Catholic Charities in St. Paul later in the evening. And we're going to hear from Kathy Tenbrook, who I think of as the homelessness czar. She has a number of titles, but she's our policy speaker tonight. Before we do that, I'm going to share, just like we did last time, we're going to go through some statistics, and these are kind of cold, hard facts, and they are, as I said, they're jarring and they're very sad. So quick review of what we did last week. We talked about the continuum of housing, and what we're going to be focusing on over the course of this webinar series are really three types of housing. The first is emergency shelter. So these are people who are sleeping outside in their car, maybe doubling up, finding friends who they can stay with for a period of time. And most provide an evening and a morning meal. Some provide additional facilities that may be laundry or access to computer. People aren't able to find emergency shelter in much of the state. 80 of the 87 Minnesota counties don't have enough beds for emergency shelter right now. And so when we talk about solutions, a big one is we need more funding here to take care of this. We want to have people move out of emergency shelter into supportive housing. And you'll hear when we talk about the health conditions and the background of some of the people who are experiencing homelessness, that they may not be prepared to move directly into independent housing. And so supportive housing provides a place to live along with a wide variety of services. Some are very focused on particular cultural needs, or people who are in treatment or with particular mental health issues. But these are places where people have a place to live. They pay rent and work, some of them are working on issues before they're able to do that. And then the goal eventually would be to have enough affordable housing for all of these folks to move into affordable housing. And just a reminder, the definition of that, this is the policy definition: when someone's spending no more than 30% of their household's income for housing. And sadly, you may recall that 20%, 1 in 5 Minnesota households is spending more than 50% of their household income for housing. So, across Minnesota, urban, suburban, rural, this is a real challenge. So I want to go over some facts from the Wilder research, does a Minnesota homeless study. And if you work in this area, you know that this is really the gold standard. Minnesota is incredibly blessed to have Wilder research and the Amherst H. Wilder Foundation here in Minnesota. And every 3 years, this will be an exception because of COVID. I'll talk about that in a minute, but they had a one-day statewide study spread out across the state to understand the prevalence of homelessness, to really do a count about how many people they can locate that are homeless, and also learn about the circumstances of those people who are experiencing homelessness, partly to better understand how people got where they are so we can look at what services to address, partly to really get a better sense of what we may be able to prevent. If we see a trend, are there things we could do to prevent those numbers from increasing? And so I'm going to go through data. There's a link to the Wilder Research Minnesota Homeless Study in our resource list, and it's really fascinating reading and wonderful analysis. This year would have been the year. The study, you'll see the data you'll see is from 2018. 2021 would have been the year for a study that happens at the end of October. This year, because of COVID and real concerns about how able they'd be to access the people they wanted to put off for the first time, they've put that study off. So that study will be happening late fall of 2022, and the JRLC will be really highly promoting it. We need people to go out and be volunteers. And these are really wonderful opportunities to get understanding of the reality of what homelessness looks like. People go out and you have a whole series of questions that you ask people. These are personal one-on-one interviews that take between 35 minutes and an hour to really get a good understanding of people's lives and what they've dealt with. So here is kind of an overview of some findings. This is a comparison from 1991 to 2018. This one night count, what the numbers look like for people experiencing homelessness. So you see over that period of time, a significant increase. And we see that in children with parents, we see that in individual adults. But despite efforts to address homelessness, this problem continues to worsen. The one place where Minnesota's made some progress around homelessness has been with veterans, but we need to work on that as well. So just incredibly high numbers. So this is the number of people that are reflected in the percentages that you'll see in the following slides. I pulled out just three big, simple statements that I wanted to focus on. The first, this was one of the things that worked in the poll, or that showed up in the poll that didn't work, that homeless children and youth 24 and under. And so Minnesota is one of the states that recognizes that we shouldn't just look at 18, that 18, we have kids that are still in high school, and, really recognizing that we have a real vulnerable population still as they're 19 and 20. And so study children under 18 as well as youth up to age 24, that those two groups make up almost half of Minnesotans experiencing homelessness, which is just an incredible amount. And think of the impact that this has on the lives of those children and those youth as they're forming and becoming the people they're going to be. 1/2 of adults experience homelessness are on a waiting list for supportive housing. And so we talk about, we need more funding. I mean, it's just that simple. We need more money for affordable housing so low wage adults can have a place to live. We need funding for supportive housing because we have so many people that could be served there and could be much more successful and live much better lives if that were available to them. And then one of the things they looked at is the median monthly income of people that took place in the survey. So people that there during that month, they reported this average median income of $550. So $500 in greater Minnesota, $600 in the Twin Cities. And no matter where you live in Minnesota, that is far less than the fair market rent for a 1-bedroom apartment. So this is not huge amounts of money. We really need to figure out, if we really care for All Guards creation, what are we going to do? So I'm going to go into some more detailed data here. This is a chart that, and again, all of this is in the resources that you can find on our webpage and that will be mailed out with you by email tomorrow. This looks at the racial breakdown of persons in Minnesota experiencing homelessness. So the blue line is within the population in general in Minnesota. And the orange line is those that are represented in the homeless population that were counted in the study. And so if you look at that second category, you see that 83% of Minnesotans are white, but less than half of those people experiencing homelessness are white. And where do those numbers get made up? They get made up with BIPOC individuals. We had the Black or African American, that was a question I used in the poll, 37% represented in the homeless population. American Indians, 1% of Minnesota's population, 12% of its homeless population. And so these numbers speak to two things. First, they speak to the fact that race and poverty are really interrelated, especially in our state. There's a huge opportunity gap, and that contributes to this, and just racism. This is a huge problem, and a pretty striking statistic. Here's a breakdown of homelessness by age group. And so at the very end of this, I'm going to talk a little bit about that older adult category. But you see 32% when we looked at those that are homeless are children 17 or younger who are with their parents. So a third, close to a third of Minnesota's homeless population are children living in cars or in unheated pole barns or wherever that might be. Another 15% are those youth 18 to 24. This next slide addresses when the people that took part in the study first experienced homelessness. And so you see those people who had a parent who served time in prison, which impacts a lot of things in a family, in a home. The average age of people who had had a parent who served time in prison when they were first homeless was 19. And for those who did not have a parent who had served time in prison, you see that's average age of 30. Okay, so think about this. If people who did not have a parent who served time in prison the first time they were experiencing homelessness was age 30. And then I'm just going to go back to this chart again to see all of the young people, all of the children 17 and younger, all the people 18 to 24 who were already homeless at this age. And so as those people age and become older, this is, you just need to think about how this is going to impact those who are going to be really struggling in our state, in our society, in our economy as we move forward. Adverse childhood experiences, I talked about briefly, and I'm just going to talk for a minute, and then I'm just going to be quiet and let people study this. But, you know, huge numbers of people in the homeless population that have had great difficulties, not only in childhood. This really represents what happened to people before age 18, but as they move into young adulthood and beyond. So I'm just going to take a moment and let people look at these numbers. I had to choose which charts and numbers to include. When you go to the study, one of the things that they show is that most of these people, or many of them, didn't have just one of these experiences. They had 3 or more. And you see data about how those are layered upon each other and how that really impacts the ability of someone to move forward and be successful. So I really encourage you to look at this study. This next one addresses health conditions. And so when we look at chronic health conditions, that could be substance abuse, it could be diabetes, it could be that nearly half of those homeless adults didn't become homeless until they were age 50 or older. So these are people who lost housing for some reason. Maybe that's job related, maybe that's related to some other health condition, significant medical expenses. And in 2018, 3 in 10 of the older homeless adults were experiencing homelessness for the first time. And this last slide I'm going to show here is a breakdown of those older adults. You can get some sense of within Minnesota's general population. Again, that is the blue line, and the orange line is those who are experiencing homelessness. So you see that, 33% of Minnesotans make up, or over that age 55 in the population as a whole, but 69% of the homeless population, you see that. So I'm going to go to our next slide here and unshare so that Joan can bring up a clip. This is from Doug Pyle. He was a former resident of Catholic Charities in Minneapolis, St. Paul. And he recorded this testimony as part of an effort, successful effort by advocates to increase funding for people who are in supportive housing, and also to change the rule, which was the case, that if you were absent for 18 or more days, you lost your spot in supportive housing. So this meant people who had a serious medical issue and ended up in the hospital, people who went into treatment, a number of other things, then lost their supportive housing. And so there's a major effort to change the law. And here is Doug's story.
Hello, my name is Douglas Pyle, and I was adopted at 6 months old, and I moved to Minnesota about 15 years ago. And along the way, through my journeys, I did come across substance abuse, which led me to lose my job and eventually lose my housing. But with the support of the shelter system here in Minneapolis, I was able to get into higher grounds. And I was there for a few months before the pandemic hit. And luckily, we were able to get into hotel rooms to help with the overcrowding, so nobody got infected with the virus. So while I was there, it's a safe place to stay. I don't worry about anybody taking your stuff or come up on you, late at night or whatever. It's a safe place in the hotel. So, and eventually, got the support of the housing program to get me into sober housing at the Alliance here in Minneapolis, and it's been great. I mean, they help you out with, rent if you need subsidized rent, stuff like that. But it's just nice paying rent again. I never was the one for handouts. I've always worked for my stuff. And during being homeless, I got a lot of handouts, but I didn't really like doing it, but I had to at the time. So another thing, like with paying rent, we had to also pay for our linens, food costs a lot. Razors, shampoo, toilet paper, everything costs a lot of money that people don't realize how much extra money that stuff takes. So with the housing support, I'm hoping that you guys can help out a little bit more to help, ease the burden of having to have everything on our shoulders right out of homelessness and addiction. It wouldn't be so much stress on us if we could get a little bit more support from you guys. And that'd be much appreciated. And I would be there, but thankfully I got a job about a couple weeks ago with the Downtown Improvement District here in Minneapolis, and that's why I can't join you guys to talk to you in person. But I appreciate y'all's vote and your support and giving us more money so we can provide for ourselves a little bit better. Thank you.
So when Doug refers to you guys, he's referring to the legislature and saying, I want to share my story with you. And I hope you understand why this additional funding for those of us in supportive housing, the $50 a month, would be so significant. And it passed. And it passed because the legislature was able to understand the needs that these people are dealing with. Rent, incidental expenses. So talk about razors, shampoo. And I just cannot stress enough, I say this all the time for people in our network, individual stories make a difference. So we'll be talking later on in our webinar series about what each of you can do to help educate your legislative representatives, your county board members, your city council, about what you see in your community, what you would like to see your community look like. And it's stories like yours and stories like Doug's that make all the difference. So we're going to close out our evening. Well, not quite close it out. Then we have our breakouts and get together. But this portion of the program, we're really lucky to have Kathy Tenbrook with us this evening. And Kathy works for Minnesota Housing, and I have her title up here. She, one of her many titles, I guess is probably the better way to say it. So she's an assistant commissioner with Minnesota Housing, but she heads up the interagency Council on Homelessness. She's going to talk a little bit about that because there isn't one single department or one single area that can solve this. She's the state director to prevent and end homelessness. And we are so pleased to have her with us. She's going to speak for maybe 15 minutes, and then we're going to have a short bit of time for people to put questions in the chat, and I'll be monitoring those and trying to gather themes that come up, and we'll have her respond to those as well. So I'm just going to stop sharing and turn it over to Kathy. Again, thank you so much for joining us.
Thank you, Anne, very much. I am very happy to be here and just delighted to be invited into this conversation. It was great to hear from Sam and Doug. And I also would love to, if Pastor Sue is still on, I especially want to thank her for her, not only her beautiful prayer, but just her incredible partnership for many, many years, but really so much during this pandemic. There's more than I could ever say. I was kind of hard pressed to find anyone else who worked harder to protect people experiencing homelessness during the pandemic. So Pastor Sue, great to hear your voice. I didn't see you, but great to hear your voice, and thank you again for all your work. So tonight I want to share a little bit about the work of the Interagency Council. I'm delighted to be here. I really don't have that many titles, and czar is not one of them. So just to be really, really clear, that is not one I've ever used. But I wanted to share a little bit more about my role and about the work of the council at the state and its role with partners all across the state. And I also want to spend some time talking about this really, I think, heartbreaking, but also really inspiring journey we have all been on together during this pandemic as we've done this work with and for people experiencing homelessness, and really what it has pushed us to do and the new vision that the council has just recently launched, which is a vision to move towards justice. And I will talk a little bit more about that as well, and the role that all of you can play in that. So I'm going to try to share my screen now, see if we can all be really tech savvy here. Host, okay, can I do this, Joan? It says I can't right now.
Okay, I'm gonna unco-host Joan.
Thank you. Just gonna ask
Sorry,
that.
Joan.
Nope, that's okay.
You.
Great. Let's see if this works.
We're a small nonprofit, so, you know, I hope people have patience with us figuring this out. It should work now.
There we go. Great. So now I'm going to pull up this, and you'll have to tell me.
It's there.
Excellent. You see it well?
Yes, thank you.
Oh, okay, great. Wonderful, wonderful. Okay, so I'm going to spend just a couple of minutes just grounding everybody. I know some of you, certainly some of you I've known for years, Joan and Doug Mitchell and others, you know all about this work, but just to get everybody a little bit on the same page and to share kind of how we're structured at the state. So this is the body that I am the executive director of. It is a Interagency Council. It's a cabinet level body led by our Lieutenant Governor, Lieutenant Governor Flanagan, and it's co-chaired by our Housing Commissioner and our Human Services Commissioner. But it has the commissioners of all of these other agencies that sit on the council as well. To the point Ann made earlier, with the full recognition that housing stability is really critically important to the work of all of those agencies and the goals we have as a whole state, but they also each really recognize the roles that they play. This cabinet level body was established under the Dayton administration, and it's just grown even more central to the priorities of the Walz administration. And working with partners all across the state over the years, we've created specific action plans focused on what will it take to prevent and end homelessness for families, for youth, for veterans, and for people who have chronic health conditions, people sleeping outside, et cetera. So I thought it might be helpful. I don't know if all of you have seen this slide before. And are you able to see the whole thing, or is this, yeah. You have full view of that? Okay.
Yeah.
Yeah.
So what I wanted to show you is a graphic that I used to describe, what do we really mean when we're talking about preventing and ending homelessness? It does not mean that no one ever again will have a housing crisis, but the goal of all of this work is to prevent those crises from leading to homelessness whenever we possibly can, to increase housing outcomes, to make homelessness rare. So we have more housing available that keeps homelessness from becoming as prevalent as it is. We make every episode of homelessness as brief as we possibly can. And then we provide the right kinds of supports and services to make sure that people don't fall back into the cycle of homelessness again. And so if we do this sort of as a system statewide, that is essentially what we mean when we talk about preventing and ending homelessness. And so here over the years are some of the strategies, just samples of strategies that we have been using or trying to use even more. And certainly probably some of these things are the things you have fought for at the legislature before. So in order to prevent new instances of homelessness, we clearly need to have a supply of housing that's truly affordable. That is the number one. But we also need to do more to move upstream, to really earlier identify people who are in a housing crisis and intervene sooner. And of course, during COVID, this became extremely relevant to all the work around eviction prevention and making sure people don't fall into homelessness through eviction. Increasing the outflow is all about more housing, but it's also about creating relationships with landlords to have them willing to step up and really support people who maybe don't have as long of a rental history, or maybe have something on their rental history that is typically problematic for them in terms of getting into housing. But to develop relationships with landlords who would be willing to take a chance and bring people into their housing. This has been a particular strategy we've used on the veterans homelessness piece. That's been mentioned a couple times, and I saw folks chatting about it. It is true that the federal government has invested far more in ending veteran homelessness than for any other population in terms of really specific dollars focused on homeless veterans, both for the housing affordability piece, the rental assistance, but also the services. And that has meant that we could really start to drive those numbers down. We've cut it more than in half over the last several years. But with that said, there still remain, we actually keep track, somewhere around 285 veterans statewide who are still experiencing homelessness, primarily in three of the major population areas of the state. And so in order to help achieve ending homelessness for them, so much of that strategy has to do with finding the landlords willing to take them. They have more significant barriers. We might even have the rental assistance and the services, but we need those landlords as well. So really important part of this story. And then the other part about ending homelessness and having more exits from homelessness is to ensure that our shelter systems and our outreach workers and everybody is geared towards housing as the solution. I will say, shelter is simply not housing. It's not an acceptable form of housing. It's never been an acceptable form of housing. It's critically important, and we'll talk a lot more about that. It saves people's lives, but we have to move towards the next step, which is housing. And then, of course, returns to homelessness, we try to prevent that with additional support services. One of the really exciting things over the last few years is our ability now to use Medicaid to do housing stabilization services to help people stay in their housing. And so using healthcare dollars on housing support has been a real breakthrough. So here is some data that we use, and I really appreciate Ann showing the Wilder research data. We couldn't agree more. I mean, Wilder research is state of the art. We're the envy of all across the country that we have that kind of a research institute focused on homelessness. We also statewide do a one-night point in time count in January every year. And so this chart shows you those numbers. So the numbers look different, but don't worry about that. It's more about looking at trend lines. It's a different time of year. It's a different methodology than Wilder. So it's just not going to be apples to apples. But what I wanted to show you is that over the years, you can see where we've had some success and where we are struggling. So overall, since 2014, when we launched our first Heading Home plan, we have actually seen a pretty significant decrease in the number of families with children experiencing homelessness. And that has been not by accident. That is actually quite remarkable given our housing crisis, but very intentional work in lots of communities across the state, and especially in Hennepin County, giving them a lot of credit for this number going down so dramatically, really targeting in on families who need the most support, tailoring the kinds of housing and services that those families need, reaching out sooner, making sure they don't fall back into homelessness, and really using data, frankly, to be really targeted in their efforts. and using more rental assistance from the state targeted to stabilizing families, identifying kids in schools who are in families that are unstable, and really targeting those families with resources. On the flip side, you can see where we have really had just really unacceptable results, and the most dramatic, which may not be a surprise to you, is the number of people sleeping outside. Even before the pandemic, those numbers were rising steadily over the course of the last 5 years. And during the pandemic, those were just exacerbated, as we all know and all saw. The pandemic made that part of this work and that part of people's lives and journeys so much more visible than it had ever been before. So speaking of the pandemic, I think this is just such an important part of the story, because we want to use everything we have just experienced over the last couple of years to drive us forward into a new way of doing business. When COVID hit, early in 2020, I think we all began to see the many challenges the pandemic had in store. And we did some initial modeling looking at some of the shelters in places like San Francisco. And what we feared was that quite literally thousands of people experiencing homelessness in the state could, one, get COVID, and two, very likely to have very adverse effects to COVID because of age, underlying health conditions, and of course, where folks are living. And so we were quite afraid of this, and we had seen the strain on healthcare systems already popping up in other parts of the country, and a lot of people experiencing homelessness getting very, very ill. So we went to the legislature in March, so just a couple of weeks, frankly, after the first case came to Minnesota, and we asked for emergency state dollars to respond to this issue. We got $26.5 million within a few weeks to distribute out to local community partners all across the state. This was unprecedented to see homelessness as that kind of an emergency, ask for what we need and receive it. So that was our first eye-opening moment that this was very different kind of response to homelessness than we'd ever seen before. And so with those dollars, we were able to stand up lots of spaces, shelter rooms, hotel rooms that you heard Doug mention, and lots of community partners across the state chipped into those resources as well. So we certainly did not do this alone. And it was because of community partners who were willing to take those dollars, create more spaces, develop relationships, and really kind of push themselves beyond their capacity that this was even possible. So here is what we know. This is literally data from today. I got from my data team for this very conversation. Since COVID hit in Minnesota of 2020, we started collecting data. We have had 1,145 people experiencing homelessness who have tested positive for COVID, and 14 have died. Now, this is 14 too many, but it is about, 100 times less or more than we thought was going to happen. And so we are very grateful to our partners for all they did to make this happen, and are still doing. We still have shelter outbreaks. We're still having rising cases. In fact, this week was one of our worst weeks in a while in terms of the number of increasing cases of COVID. So we will not be done with this pandemic until we hit our vaccination rates that we need. And in our shelter system, that has been tough. But here are a few things I wanted to share with all of you. I just moved this, I'm blocking my own screen here, there we go. So here's some of the specific strategies during COVID that we utilized. We had a Department of Public Health had a homeless specific team that worked with partners all across the state for guidance and technical assistance to figure out how to handle the pandemic. Public health systems and homeless systems had hardly ever really worked together before. In fact, in many, many parts of the state, they didn't even know each other existed before the pandemic. So this was a big moment to bring those systems together. I'll talk more about that in a moment, because we actually never want them to ever be apart again, because homelessness is indeed a public health issue. funding for shelter decompression, which I mentioned, isolation space. So when people did get sick, they could have a safer place to isolate and recover, protective equipment. And then not only the spaces that were created, but also using state existing dollars and other dollars more creatively than we'd ever used before. Housing support program came and really literally provided supports to bring people directly from encampments into hotels. And something that I think we all should be really proud of is that when the vaccine finally did come and we were finally able to start getting the vaccine out, people experiencing homelessness and those who are serving them were prioritized in the very first phase of the vaccine work. And I think that we were one of only 2 states in the nation that did that. So that is also a testament to the advocacy and the folks who were really standing up and talking about the importance of protecting people experiencing homelessness. We have new vaccine incentives and trusted messengers now going into shelters, people with lived experience being trained and supported to share their stories about the vaccine, to share their understanding, and to help break down some of the misunderstandings about vaccines that are out there. And really, frankly, just to provide information, not so much to try to convince anybody, but to try to make sure that they're making decisions based on accurate information and have a safe place where they can ask their questions and have them answered. With all the work that's been done, and even with the prioritization of folks in the first phase, our numbers are still very low. Only 1/3 of people experiencing homelessness across the state have received 1 shot, and only 1/4 have had both of their shots. And so this is where, so much of our work and so much of our focus is right now, is trying to increase that rate so we can protect people more effectively. But public and private dollars have really come forward to help us do that work and to be culturally specific and to really build stronger relationships with community partners who would be successful. And then I'm putting this slide up. I'm going to send all of these slides to Anne, so I hope you don't feel overwhelmed, but I just wanted to show you this because these numbers are staggering to me, somebody who's been in this work for almost 30 years. I have never seen over the course of a year the kinds of resources, both federal and state legislative resources, that have been authorized to impact homelessness. And so, the emergency services program, for those of you who are less familiar, was a relatively small program at the Department of Human Services that funded shelter space throughout the state. It was actually, very underfunded for many, many years. I think prior to the last legislative session, it was less than $1 million a year. So this puts this in perspective. We, since the pandemic began, have allocated about $55 million through that program out to the community. More dollars for veteran homelessness, more obviously the eviction prevention dollars are pretty well known. And of course now the rent help MN dollars as well. But I say this because I think as we think about advocacy and about legislative work, we have learned during COVID that the scale of need is, we've always known it's great, but the amount of resource it really takes to meet that need is perhaps far greater than most people have ever truly asked for or gone for or really committed themselves to try to achieve. There's also some new dollars that were just literally in the last few weeks from the Fiscal Recovery Fund, which is a part of the federal response to COVID. We just launched a $10 million outbreak response RFP for shelters, and then another $15 million is coming out next month for capital for shelters to make them safer. So I say all of that once again, just to give you a sense of scale in terms of how dramatic these investments have been and how we cannot go back to the level of investments that we saw before. And so based on all of this work that we did during COVID with all of the amazing, truly amazing partners and providers and with people with lived experience of homelessness every week working together on this, we brought to the council a recommendation of taking all that we had learned to move forward towards a vision of justice, and not just around what it would mean to prevent and end homelessness in the way we had typically thought about it before, but what would it mean to actually get closer to the root causes of homelessness and focus our efforts and our attention on justice. And justice is required when you have the kinds of disparities that we see in Minnesota. And I know Anne shared a little bit of this already, and I hate to put more data in front of you, but this one is a graph that I look at all the time. And it is the one that makes me just really, frankly, just sort of grounds me more than any other data I see as it relates to inequity. So what this graph is showing you is on the far left-hand side, that is just the general population, sort of what's the racial ethnic breakdown of our general population in Minnesota. When you move to the right, just that first spot, that is people in poverty. And you can start to see there is some disparity there, right? So the red line, for example, is Black Minnesotans. So Black Minnesotans, what you see there, they are 4 times more likely to be in poverty than white Minnesotans. But then go to the next point, the homeless population. You can see the dramatic jump in disparities to 13 times more likely for Black Minnesotans to be homeless than white Minnesotans, and 22 times more likely for American Indian Minnesotans to be homeless than white Minnesotans. And if you go to unsheltered populations, that disparity grows even more for American Indians. So this slide for me is really important because I think there is a tendency to think that most of the disparity is related simply to the poverty of folks, but there is something very different happening when you reach the level of poverty and the level of circumstance and environment and loss of housing, and all the inequities sort of start to layer on top of each other, racism and health disparities, to lead to the level of disparities that we see in homelessness. So I won't go much into this one, except to say that this is a chart we showed the council as we said, we're trying to really pull all of our work that we do on homelessness now in the state to be work that is far more focused on centering people experiencing homelessness at the very beginning of every policy, program, budget decision. Often over the years, and certainly in my many years of being in various roles, both in government and in nonprofit work, we've seen pilots or programs that have tried to target some good work at people experiencing homelessness, but more often than not, we've seen people sort of tokenized or even marginalized. But very rarely do we see people centered, meaning that we are actually designing the very effort, whether it's a program or a policy or a decision, we're designing it around people experiencing homelessness and what they're telling us works for them. That is much less common, and that is really the ultimate goal of this work that we are about to embark on. And so the frame for the vision of the council is now one to move towards justice. So I show you these as an attempt to show kind of an evolution over the course of many years, not to say that it is linear. We don't see any of this as linear, but we have evolved over time. In the early 2000s was when the movement to end homelessness was really gaining ground all across the country. What would it take to move away from managing homelessness to ending it? So more programs were created that really targeted people and improved the visibility of the work. It was really important. There's nothing not good about that moment. Then we started recognizing that we really needed to talk more about housing stability. What did creating housing stability mean for all of the goals we have for kids, for their educational outcomes, for health outcomes? And that was really an important part of the evolution of our work, to see it so interconnected with so many things that we care about. But now, trying to understand what would it mean if we as an entire state really moved towards a vision of justice? What would it mean to achieve housing justice. Naming homelessness and housing instability as forms of injustice at every opportunity that we have. And really shifting more of our focus to the underlying causes. Frankly, moving towards the vision and the idea that housing is a human right. Regardless of anyone's circumstances, housing is a human right. And we also know that there's no chance of any kind of justice as it relates to housing or health or any other justice if we don't have racial justice. And so I think for many years, we've been talking about racial disparities in this state. We know our disparities are off the charts terrible in many, many aspects of life in Minnesota. And we measure it and we talk about it. And that's one part of the evolution. And then we've, spent more time talking about what does equity look like, changing the way we do funding at the state, having equity sort of checklists on making sure that we're really looking to how to promote equity in our work and in our policies. And that's been a really important part of this journey. Achieving racial justice, of course, is really about, as it relates to homelessness, is really about rooting homelessness and the reason so many people are experiencing homelessness, not about individual choices, not about individual decisions or circumstances, but about a history of racist housing policy and, frankly, a present of racist housing policy and practices, and all the layers of injustice, whether it's racism that has shown up in our education system, in our correction system, in our income inequality. All of it has really been the layers that have created the level of homelessness that we see today. And what would it mean to evaluate a state plan to end homelessness by looking at each of the actions and strategies and just deciding if they are either racist or anti-racist? That would be a new way that we would do business in Minnesota. And then finally, during COVID, we saw finally at last, I think what many people, and probably many of you and many of our providers and many of us who've been doing this work a long time have seen homelessness as a public health crisis for years. But that has not been recognized, certainly, not nationally and not within sort of systems that operate to support people experiencing homelessness. It's been hard to have those systems really see homelessness as the public health crisis that it is. We've recognized the health impacts. The Wilder Research Study, for example, is very good about talking about the overlapping health crises that people experience. But we've started then to get health programs more involved. Some pilots really started up to really use healthcare dollars to show that by supporting housing stability, you could really save money on the back end in healthcare systems. But what, once again, would achieving health justice mean? And we think it would mean from moving away from thinking about individual health decisions to the health of this community being more of a public health concern, that there is really, when you think about COVID, it's been so striking to me who has been more greatly impacted by COVID. Communities of color, people living in congregate settings like in homeless shelters. While we've been successful overall at preventing more deaths, which I'm grateful for, it is also true that people in shelter are 4 times more likely to end up in the hospital if they get COVID than if they weren't in shelter. And people sleeping outside are 8 times more likely to end up in the hospital. So that's not health justice. And what is really understanding that there's no biological reason that those folks would have higher, poorer outcomes to COVID other than their environment, the lack of support, the lack of access, and injustice. And so here's the new vision for the council. It's going to be very, very hard. It's going to be an incredible amount of work. And I think the council understands deeply that none of this can even start without first beginning with the community, with people most impacted by homelessness, by the work, and people, of course, with lived experience of homelessness themselves. And so we are just embarking on the beginning of this journey. And I hope that all of you will want to be a part of that journey with us. I think in many ways, we are in the midst of a pretty big experiment right now with the level of dollars coming from the federal government. Temporary rental assistance has never had the kind of funding that we see today, but will it lead to sustained investment or will it disappear? Resources better tuned to what people need and how these dollars flow to keep people stably housed are so important. Are we gonna really take what we've learned and lower the barriers and move towards housing justice and housing as a human right? Or will we revert back to accepting the fact that millions of Americans can be on the street or in shelter? And so, you know, what does justice mean is maybe the first beginning of this journey. And so that's what we're going to be doing. We're going to be pulling together some members of the community all across the state to help us really define that and to help us move towards this vision. My very last slide, I promise, this is last year's budget. And I show you this because I know you're going to be thinking about your own platform going forward and the kinds of things to raise your voice for. I can tell you that this budget was the largest budget in state history for homelessness. And it was really an incredible outcome. And thanks to all of you, to so many others talking about homelessness and the importance of housing stability, for not just this year, but for so many years, has really brought us to a very interesting moment where I think we can continue to increase the kinds of investments that we're seeing in this work. So I wanted you to see what you achieved last year if you hadn't seen it all on one slide before, you and so many others across the state. And with that, I'm going to stop sharing my screen so I can actually see all of you again, because it's very strange to talk to yourself. I don't like that part. I really can't wait till we're all back together again. That is my least favorite part of this, but I hope that was helpful.
This was wonderful. And I think looking at the new justice initiative is really exciting, but also really human. And, you know, it's interesting to see how you have the track for health justice and racial justice and housing justice, but the real recognition that all of those are intertwined. You know, there's different lenses to look at the actual people that are dealing with those issues. So that's lovely. We got a number of comments, but I want to make sure we have time for breakup groups. So I'm just going to ask you one question.
Okay.
That came from Linda, which is, how do we keep some of the positive things that happened during COVID, that people didn't need to be out right away at 8 a.m. and they didn't have to wait till 8 p.m. to come in, or that some people could actually have a private room where they could lock the door and feel safe for the first time in a really long time? How do we keep some of the good things that came out as we move forward?
Yes, it is a great question. We invest in them. That's what we do. We invest in them because some of the reasons that shelters have had those operating rules for so many years, things like you have to be out the door first thing in the morning, it has been an underfunded system for a very long time. And so the lack of staff and support and ability to run shelters 24 hours a day, that was one of the best things that happened in terms of our shelter system, is that people left their doors open all day. So people had a place to be, they could be inside. And then that also gives people more time to work on the next step towards housing, which of course is the whole message, is to work directly with people to figure out what will work for them and what they want next, but not to have shelter be the landing place. But Linda, I think that's a great question, and lots of shelters and lots of communities are deep in that conversation right now in terms of how they use their American Rescue Plan dollars to really support their local partners to do that kind of rethinking. The dollars, for example, that we are putting out, there's some capital, the $15 million new dollars in capital that I mentioned. Those dollars are to help shelters reconfigure their spaces to make them safer and more public health informed. And I can guarantee that at least as long as I'm in this role and as long as there's folks in this role who lived through this moment together, we are going to continue to fight for a public health informed approach to all of this work, because it has really changed the way we collectively, the big we, think about the safety and the prioritization of people experiencing homelessness, no matter where they are, outside, in a shelter, or in housing.
Oh, thank you, Kathy. Always, it's so wonderful for you to join us. We are so pleased to be partners with you in this work. And as always, a lot to think about and really looking forward to seeing what happens with the agency, that the council. That'll be great. I'm going to block out Kathy for all of you just for a moment. I want to make sure that we have a chance to do our breakouts and still stay close to the time frame, because it's something people really appreciated. I don't know that you're going to have time to get through these questions, but I think the big question is, what surprised you about these presentations by, I think just focus on Kathy, but what was in the Wilder study that really surprised you? And I don't know that we're going to get a whole lot of time beyond that to talk, but if you can, either in your groups or just thinking about, how can you share what you've learned and what you see in your community in order to address some of these issues when you talk to your elected officials. So I'm going to put you into breakout groups, and they're just randomly assigned. And I'm going to call you back together about just a few minutes before 8 o'clock, so that you have time to hear what our homework assignment it is and where we're going from here. But once again, thank you to Sam and to Doug for being willing to share their story. Thank you to Pastor Stu for her prayer, and especially thank you to Kathy for taking time. I know how busy you are, and these are advocates that worked really hard, especially on the emergency shelter support bill. So it's really nice to see the recognition of the importance of that, and that increase is ongoing funds. So we're going into breakout groups, and I will see you all shortly. You have to actually accept going into your room. So thanks.